Are you interested in learning how to serve the underprivileged communities? Are you interested in learning how to partner with nonprofit organizations, government organizations to be able to follow your dreams and help serve those underprivileged communities? On today's podcast, we have a rock star eye care that has shown so much love to Defocus Media. It's only right that we show the love back to her. Friends and family, we're going live here in a couple seconds and we're going to hang out with the one and only, my friends, Dr. Karen Slate. Let's go. This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus. What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover. Welcome back to Defocus Media, optometry's #1 podcast network, where we talk about all things that's great, but most importantly, we love to share the stories of our colleagues. You see, in optometry, we have an amazing profession. And the cool thing about all of our doctors in optometry is that they have an amazing story. And their story really helps to elevate the entire eye care industry. And on today's podcast, today's live stream, we have Dr. Karen Slate. Dr. Slate, how are you doing today, my friend?
Good. How are you?
I'm doing fantastic. Thanks for asking. And happy Wednesday, happy hump day. I don't know about you, but it's been a long week for me. Top of the week, we had Labor Day, so I didn't work. But, whenever you have a day off, it seems like it's a hot mess when you get back into the mix of seeing patients because you got to play catch up, right?
Absolutely.
Well, super excited to have you on the show. Again, I just want to give you many thanks for always supporting the content that Defocus Media puts out. If there's, one colleague that I can rely on that's going to show love and support, it's you. And I don't take that lightly. And I just want the whole world to know how much that you have supported our organization with the content that we put out regularly on LinkedIn. I know sometimes it can essentially seem like spam, but I promise we're trying to uplift the profession and educate our professionals to know that there's different ways to change the healthcare system through optometry. But today I really like to talk about your story. I want to talk about your journey. I want to talk about how you really elevated the eye care industry in regards to helping the underprivileged community. And before we get started, I always gotta, talk to my guests and learn a little bit more about them. So if you don't mind, maybe sharing a little bit about your background, where you're from, what optometry school you went to, kind of how you got into this amazing profession known as optometry.
Sure. So, born and raised in Reading, Pennsylvania. Stayed local to go to college. Went to the Pennsylvania College of Optometry in Philadelphia. I always knew I wanted to be a doctor from the
Nice.
time I was little. But when I got to college, my advisor said to me, follow every single type of doctor you can think of and then go from there. And optometry just had everything that I wanted.
Nice. Very nice. So PCO, I went to PCO as well. PCO is now part of Drexel. Shout out to them for
Yes,
making
it
that
is.
partnership and that collaboration. I think that's going to help to elevate the program. I think there's a
Absolutely.
ton of great resources there. So I can't wait to see how this partnership evolves over the next 5 years.
Right.
Now, with that being said, Dr. Slate, I would love to jump into kind of your career because you've really practiced all types of different modalities when it comes to optometry. And I know you've kind of found your passion, your love, but let's kind of take it to the beginning and just talk about, when you're fresh out of school, your first job, what that experience was, and kind of walk me through the different modalities of practice that you've experienced.
Sure. So I spent the first 12 years in private practice. I was at a medical oriented private practice. Um, when I started, there were four of us and there were two locations. By the time I left 12 years later, there were seven of us with three locations, a nursing home, and we were the only optometrists that were on staff at the local hospital. So I was exposed to so much. Um, and it was a dream come true. It was absolutely where I wanted to be. Um, and then the pandemic hit, and all of us had to take a seat and sit back for 6 weeks. And I started to reevaluate. I went into healthcare because I wanted to help people. And not to say I wasn't helping people in private practice, but I felt like I wasn't reaching the people who needed me the most.
Yeah, I love it.
So started exploring what was around and what was available. Um, Luckily, I stumbled across an ad for a contracted optometrist at Nemours Senior Care, which serves senior citizens, so over the age of 65, um, who make less than, I believe it's 23,000 a year.
Oh, wow.
So
Okay.
yeah, um, hearing, optometry, and dental services for them. Um, Kind of catching those people that are in the gap with Medicaid, Medicare, um, and a lot of them are medically complex. So going from that medical private practice, it was the perfect introduction to being contracted and working with a nonprofit.
I love it. I love it.
Yeah.
I always share on this podcast that I'm a man of faith, and I feel like everything happens for a reason. And I feel like those first 12 years of private practice, to your point, really prepared you for, your purpose, your passion.
Right.
It made you more astute when it comes to these
Mhm.
complex medical conditions. It made you be able to understand how to communicate when you have these complex medical conditions and break it down into a layman's term where someone can understand, but most importantly, connect with you and build that trust over time. So it's amazing that you get to show that you can really ever do you can do whatever you want in optometry. And then
Right.
sometimes that we just go through different seasons to get us to
Mhm.
where we want to go. And sometimes it can take a year, sometimes it can take 12 years. But the
Mhm.
beautiful thing about optometry is there's always opportunity to pivot and do something different because there's so many people that need our help.
Right. Absolutely.
I love it. I love it. So, okay, partnerships. I know you've worked with nonprofits. I know worked with government agencies. I always like for our guests to really kind of break down, what they do because there is a doctor out there that's going through the same thing that you went
Mhm.
through,
Right.
and they want the blueprint. And I don't have the blueprint, so I'm curious
Mhm.
to know if you don't mind maybe sharing the steps of, how do you get started? I mean, do we set up an LLC? Do we have to connect with certain people in certain places? Kind of walk us through that journey of what that looks like, if you don't mind.
Absolutely. So I did set up an LLC because all of these contracted positions are 1099.
Okay.
Um, so that LLC is who I run my contracts through. Um, Run it as a business because essentially it is. I'm just
Yeah.
my only employee. But and then finding those contracts, just like the one with senior care, I stumbled into my next contract because I started seeing advertisements for Vision to Learn that they were looking for someone in the state. Um, and I was at that point where I had been with senior care for over a year. I was dealing with just senior citizens, and I loved that dynamic, but I felt like I was missing the pediatric part of it. So it just gave me that little piece. Um, so then I had both ends of the spectrum.
Yeah.
Um,
My colleague that I practice with or travel with to talk to
mhm,
students, she calls that from womb to tomb, right? You
yes.
got the babies to your
Mhm,
your senior citizens, or I hate to
mhm.
use that term because I got in trouble with that one day. I said senior citizens, or I said elderly. Now I just say it more seasoned folks. I like to
Yes,
be
that's
easy,
perfect.
a little more smooth with the verbiage there.
Mhm,
So you get these contracts. You figure out what your like is. Clearly, you like to
mhm,
work with pediatrics. You need that fixed. Clearly, you like to work with senior citizens. You
mhm.
got that fixed. But when you're getting these contracts, is there a place that you go to look for these contracts, or is it just more of who you know and you get put in the right position? How do you go about really setting up yourself for success to make sure that you have the right contracts, and where do you look to find these?
So both of those contracts just happened to pop up on LinkedIn.
Oh, nice.
And just as I'm connecting with our colleagues and other healthcare professionals and some of my other friends in their professions, it's something that I came across. Um, but now it's something that I also do searches for and monitor. So looking for contracted positions, looking for nonprofits, just kind of using those keywords when I search for it, just to see what pops up. I also joined the Association of Clinicians for the Underprivileged, and they send a weekly email with open positions. Not as many optometry positions as other specialties,
Sure.
but they recognize that we're just as important.
I love it. I love it. Now, when I hear this, I wonder, what is the relationship and partnerships with other healthcare disciplinaries? Because when you talk about senior citizens or seasoned folks, you think that there's going to be a team, right? There's going to be a lot of people
Right.
working together to make sure that that patient has the best healthcare. Do you find yourself collaborating more with other healthcare disciplinaries doing this mode of practice than when you were in private practice?
So in private practice, the practice I was at, we had no issue calling other practitioners, setting things up, making the proper referrals, and making those connections. I find that I need to take that skill the next step further.
Oh, wow.
So we kind of take on a social work position
Okay.
with it, definitely facilitating a lot more of coordination of care. Um, Also talking to senior centers, coordinating with the local transportation, things like that. The local Lions clubs have been fantastic in helping us to get cataract surgeries paid for. Um,
Nice.
so, yeah, kind of just not being afraid to get out in the community and express what these patients need.
I love it. I love it. I love it. Now let's take a step back, and when I think about this care, Vision to Learn, I think about the senior care. Are you having to buy equipment to go into these different facilities to examine these eyes? What does that process look like? Because again, someone's listening, they're watching, and they understand they're a 1099. They understand that they really have to be great at networking. They understand that they have to market themselves and look for contracts,
Mhm.
but they're probably looking at that financial piece. What investment am I going to have to make to get this party started?
So, luckily, both of those provide all of the equipment.
Oh,
So
nice.
you walk into the office and everything is there that you need, or you climb onto the van and all of the equipment you need is there. There are some contracts that I've seen come across that you have to have your own portable slit lamp, which,
Okay.
with eBay and things like that these days, you can easily find one for under $500. Um, so it's not too much of a deterrent, and it is a business expense. So something to always keep in mind.
I love it. I love it. I love it. So, okay. All right. So it seems like it's not a heavy lift when it comes to the finance aspect, because you can always look for potential partners or contracts that supply everything that you need, and you just show up and put in the work. Now, for those that are like me and like to know where I'm going,
Mhm.
how long do these contracts typically last? Is this something that's a month contract, 6 months, an annual contract, rolling contract? What does that typically look like?
So they can be as long as you want.
Oh,
Um,
nice.
so I've seen some of the government contracts where it's 6 to 8 weeks, um, which seems really short to me. But the current government contract that I have doing disability exams, that one is just an ongoing basis until I say I'm done or they decide that they don't need me anymore.
Gotcha, gotcha. Okay, all right. So
Mhm.
you're giving us some gems here. We're kind of getting the. I'm seeing the picture now. I'm starting to understand it a little more clearer there for sure. Now you mentioned government
Mhm.
contracts. When I hear government, I love my government. They take care of us, no doubt about that. I also get scared, right? So I'm curious to know, how has it been to obtain contracts with the government? Is that a difficult task, or is that pretty straightforward?
So they tend to come through a second party.
Okay.
So usually there is a healthcare company, a big global one, or a recruiting company, and they're
Okay.
the ones that are the middleman and they handle it. So they're hiring healthcare providers from all different specialties to fit that government need. So they're not just hiring one person at a time with the contract. So
Sure. Sure.
I really haven't had to negotiate anything. It's been, this is our contract. Do you like it? So that one's been
Nice.
easy.
Okay. So and let's break down this contract a little bit more. I mean, I know you apply for it, but what information are they looking for? Are they asking for maybe refer character references? Are they asking for financial documents? Are they asking for you to fill out a long application? What does that typically look like?
So there's an application. They want your resume or your CV.
Okay.
They do want referrals and they do call them.
Okay.
So make sure it's somebody that has actually worked with you, knows how you function,
Right.
and not just your best friend. Um, but it's not too bad. They just want to know that you're a professional and that you can handle seeing those patients.
Gotcha. And does it take a decent amount of time? Are we talking about one
It does
day,
take a couple
couple
months.
weeks, months? Okay,
Yeah.
gotcha. Got
About 90 days, so 3 months.
okay.
Mhm.
So that's interesting. I mean, how do you manage that, right? Because if I hear 90 days, couple of
Mhm.
months, and I'm trying to balance my year out, what does that look like for job security? Are there, a couple weeks where you're not working, couple months where you're not working, or there's so many different partnerships and contracts that you have that you kind of have something
Right.
to do every day?
Everything's set. Yeah.
Gotcha,
So
gotcha.
I
So
have
with
my week
you,
filled.
gotcha. So you kind of build out your routine annually and kind of know where you're going to go to make sure everything is secure. Gotcha. So, all right, let's take it a step further. I want you to kind of walk me through your typical day with this type of work. I know it's going to be different from pediatrics to, more of your senior and then the disability, but I'm pretty sure there's some common themes throughout these days. But what does it typically look like? What time do you wake up? What time do you get started? How many patients are you seeing a day? What time do you tend to end? I would love to learn a little bit more about the ins and outs of your actual day when you practice.
So a senior care day is 8 to 4.
Okay.
Um, so typically I see 8 to 10 patients. And coming from private practice, that seemed like a really small number until I realized how much went into it and how much time I'm actually in the exam room.
Right,
Um,
right.
and then how much time I'm back in my office now calling and coordinating and charting and ordering. Um, so each patient takes quite a bit of time. So 10 is a full day.
Gotcha. And what about for the pediatric crowd? What does that typically look like?
So that's based around a school schedule.
Okay.
So we usually arrive, I drive to the school, I meet my technician slash optician who drives the van.
Okay.
We get there right around the time that the students are finally entering the school, buses are starting to leave, car lines starting to go away, so that we can set up out front or wherever they have us designated for that day. And most of the school nurses are fantastic. They have their list, they know exactly who needs to be seen, who's a priority. And we just roll through that. And it's one student after the other, after the other, after the other. And then about 10, 15 minutes before the buses are arriving and trying to push us out of the way, we're hurrying to pack up and get out of there.
I love it. I love it. And tell me this, is this a 4 day, 5 day, 6 day work week? What does that typically look like as well?
I usually do 4.5 days.
Okay.
So Um, I will do a half day of senior care on Fridays. That way I can still get to my girls' school and, do the family thing and
Gotcha.
feel like I'm in control.
So, and with that being said, it sounds like with this opportunity of the populations that you're serving, it's giving you that work-life balance you're looking for. Is that safe to
Yes.
say?
Oh, absolutely. Absolutely.
Good, good, good. And with the new generation of ODs and optometrists, that is something that is huge. So for
Yes.
all my student doctors, all my new graduates, consider serving the underprivileged community, whether it's partnering with organizations like Senior Care or something similar,
Mhm.
or Vision to Learn, or partnering with Dr. Slate. She could put you on the game, I'm pretty sure, and help consult and get you the right direction, because there are different ways of practicing. It's not just
Right.
private, it's not just corporate, it's not just academia, it's not just research. The beautiful thing about optometry is that you can really do whatever the hell you want to do. And
Absolutely.
you can create a schedule that's going to accommodate your lifestyle, but you can also find a modality that's going to fill you in or fill you up, make you feel good, right?
Mhm.
And feel like you're living your purpose. And Dr.
Mhm.
Slate has done a fantastic job with that. Now, the one question I know everyone is asking or thinking about in their head is this lucrative, right? Because optometry is extremely lucrative.
Mhm.
But when you think about government contracts and altering your schedule, less load, how does that look from a financial standpoint?
It definitely pays the bills.
Okay.
Um, you know, it all depends on the contract that you have, what your hourly rate is. Um, you can make it as lucrative as you want to. You can also price yourself out of it. Um, but again, you're running a business.
Oh, I didn't think about that piece, because if
Mhm.
you're doing contracts and you're bidding, depending on
Mhm.
what you say your cost is per exam or per service or your
Mhm.
overall fee, if you're shooting for the sky, you're probably shooting
Right.
yourself in the foot.
Right.
So you have to
Mhm.
be mindful, and that's why it's great to have mentors or talk
Mhm.
to people or consult that do the work that you're trying to do, so you can have a
Right.
better perception of what it looks like. And the
Mhm.
cool thing about what you're doing, there's not a lot of folks doing it. So I'm
Right.
pretty sure the landscape is wide open, and there's a lot of opportunity
Mhm.
to really, number one, help a lot of people that need the help. But number
Absolutely.
two, to your point, if you want to make it lucrative, you can make that happen as well. Me personally, I love helping patients live their best lives.
Mhm.
That's our purpose with the organization that I'm a part of at my eye doctor. But I also like to make a good living. My wife likes nice things. My kids like to travel. I like nice things as well. So when I can balance both of those things and make that magic happen, to me, it's just I'm winning. But most importantly, my patients are winning. So I love that throughout this entire podcast, throughout this entire interview, that you've been very transparent, very candid, because people need to know this. They need to know what's out there. And I really appreciate you breaking everything down for us today. This has been fantastic.
This was fun.
Now,
Thank you.
yeah, no, thank you. And before I let you go, I always like to ask this question to all my colleagues out there. When it's your turn to retire your phoropter, your turn or your time to leave a legacy, what do you want to be known for?
I don't know. I guess that I did everything I could to make the our field as helpful and as good as it can possibly be.
Yeah. Well, I mean, you're doing it, right? And again, just telling your story, 12 years private practice. Ever since the pandemic hit, you pivoted, you're serving the underprivileged community. A lot of folks aren't focused on that. They're focused
Mhm.
on communities that have vision insurance,
Right.
communities that can pay
Mhm.
for eye care, communities that are not in that gap area that you were
Mhm.
talking about. So you are living what you express. You're making the
Mhm.
magic happen. And it's ODs like you, it's optometrists like you, eye care professionals like you that make us all look good, because you're getting out there really making the magic happen. So, on behalf
Mhm.
of eye care, I want to thank you for all the great work that you have done. Now, before we leave, if anyone is looking to learn more about this or consult with you, what's the best way for them to connect with you?
Email is always the best.
Awesome. Do you have an email we want to drop, or a LinkedIn handle we want to drop, or what?
Email is klslateod@gmail.com.
Gotcha. Awesome. Well, this has been great. I can't let you go yet because I was reading into your bio a little bit more, and there was a couple of things that I wanted to touch on that are fun and exciting. And to begin with, I found out that you are a tattoo enthusiast. Um, I am scared as hell to get a tattoo. When I was younger, I thought I was going to get a big tattoo on my back,
Mhm.
and then I was like, yeah, that ain't going to happen. So I'm curious to know, how many tattoos do you have, and how did you get into the world of tattoos?
I have 9 tattoos. Um, I just like the way tattoos look,
Okay,
and it expresses me. So each and every one I've thought through and has a special meaning to me, and it's something that I carry with me each day.
I love it. I love it. So not
Mhm.
only are you, living your story, but you're also tattooing the story along with you. Talk about branding and marketing yourself. I love it. Right. Now, the next cool thing that's a fun fact, and normally we start the podcast off with these, but I think it's cool to end it as well, right? You're a Greyhound mommy. Tell us about your
Yes.
Greyhound, about your dog.
So my Greyhound is Sammy. Her racing name was Bart's Mirrorball, which
Okay.
always makes me think of The Simpsons with Santa's little helper.
Right,
Um,
right.
but she raced for 2 years and then was retired, and I rescued her. So I've had her for 10 years now.
I love it. I love it. I used to have two dogs when I was younger. I had a lab mixed with a Dotson. His name was Midnight. He was jet black. And then I had a Dalmatian mixed with a lab, and her name was Sparkles.
Oh,
And
very
oh
nice.
yeah, completely opposites with dogs, completely opposite personalities. But I've always been a dog lover. I don't have one now. My wife told me no. But little does she know, as my kids get older, especially my daughter, because she's 3 now, and they can take care of the dog, I'm getting a damn dog. So that's to be continued. We will be there at some point in time. But lastly, I wanted to touch on Jeep lover. You got to talk to me about that because I've met some Jeep lovers, and if it's the Jeep I'm thinking about, the vehicle,
Yes.
all those folks I know, they're out there with that riding around with the doors off and all that other stuff. So you gotta talk to me a little bit more about that.
So I am on my third Jeep.
Okay.
Um, my husband is on his second.
Oh wow.
Um, yes. And
Okay.
my stepdaughter had a Jeep Wrangler. She did trade it in for a Jeep Renegade, which is a little bit smaller and the top doesn't
Okay.
come off.
Yeah.
But we are a Jeep family.
Okay.
Um, it's just so much fun to ride around with the top back and just really enjoy the summer and feel kind of beachy since we're technically in a beach state.
Yeah. I love it. I love it. Well, this has been fantastic. I appreciate it. You're getting a lot of love here. I think this is probably one of the best ways to end the show. Helen Whitaker, who's been a long viewer and partner on the show, said, "Wow, this is so insightful and inspiring. Thank you, Dr. Kara Slate, for all that you do. Having a huge heart in eye care is unique and wonderful." And I think that's what it's all about. I know one of your themes in life is striving to thrive. And I think you've done that personally. I think you've done that professionally. And I just want to thank you again on behalf of Eye Care for all the amazing work that you have done. If there's anything that Defocus Media can do to help elevate what you're doing in those under privileged communities, please feel free to reach out. And for all of our partners out there, let's see you also continue to partner with Dr. Slade. I know she needs help with glasses, frames, contacts, drugs, things of that nature. So for all of my colleagues out there that are listening, step your game up, make the magic happen, and share the love. But for everyone out there listening, thanks again so much for tuning in. Dr. Slade, thank you again. It's your favorite optometrist, Dr. Darryl Glover. Stay healthy, stay positive, stay blessed, and until next time, peace. Hey, family, if you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.